walking into a doctor's office can be very much of a daunting experience, especially if you're hypermobile. And there are 5 questions that I recommend to all of my hypermobile patients to keep in mind when they go to a doctor's visit for the first time. The questions to ask and the things that I recommend to them is that it does help to go with a folder with nicely divided categories of the different tests you've had, different complaints you have. If you filled out the 2017 EDS Society guideline, that would be good. If you have any images, any reports, all of those nicely categorized. I know that sometimes when you show up with a folder, it freaks some of the providers, because when there is a set number of minutes they can spend with you and you have a long folder full of file, it can be very frustrating. Unfortunately, this is one of the reasons why a lot of patients with, a lot of providers that treat patients with hypermobility actually do go at a network, because they're not limited by time and they're not limited by having so many. The guidelines different. The guidelines, meaning, I always say I'm committed to patients, not insurance companies. So there are different reasons. Go with the folder, ask and talk to the front desk when you make an appointment, kind of get a feel of the office, and just be polite, but just don't be a doormat type of situation. Don't be afraid to ask questions. The questions that you want to ask your provider are, do they treat hypermobile individuals? Are they comfortable treating hypermobile individuals? Do they have any referrals for cardiologists, for GI, for geneticists? These are like essentially good places to start a baseline at. You want to ask them if they are okay if you come across any rare research that's done, if you come across, if they're okay to send those to them. If they say yes, then it shows that they're very much interested in expanding their knowledge and to basically learn more. There is always a lot more to learn. Do understand that there are providers who basically may not know enough. We never learn about hypermobility in school, but I, for example, became very interested in hypermobility because I was treating pelvic floor dysfunction, pelvic instability, and then all of a sudden the whole pool of my patients were hypermobiles, and this kind of started to happen. So in the process of learning and treating hypermobile individuals, I ended up learning a lot more than just joint hypermobility, and I ended up connecting with a circle of providers that I refer patients to. Those providers are also interested in patients with hypermobility. So you want to ask, if a patient of mine asks me, hey, do you mind if I send you research? Of course I'm going to be all over it. You are going to encounter providers who are at different level of understanding of what EDS or hypermobility is. But if they show interest, then you're on the right track. So don't be afraid of seeing a provider and having to repeat. I understand how you're used to basically gaslighting and being disbelieved and just being excited that the provider believed you. But these are the right questions to ask. Ask the provider if they recommend any local groups or any groups that you can be a part of where you are asking other hypermobiles for their experiences with different providers, with different questions that you may have. You want to be a part of a group in general. So see if those providers can recommend any local groups that you can belong to, and of course you can assess them accordingly. That's essentially it. I do want you to subscribe to my channel. This channel is all about you, hypermobility, and all challenges related to joint hypermobility. I have social media that basically I put in, of course, with 60 seconds. So there are tips and questions, short questions, or basically bits and pieces of information that I hope are valuable to you. Please make sure you subscribe to the channel and you turn the notification bell on so you get notified of any other videos that I put on. And share this channel with your bendy friends, and do know that there are providers that care for you more than you realize. Thanks for watching, and until next time, take care.